Hey, I want to talk briefly about Medicare for All and specifically the costs or the projected costs of the Medicare for All program. When people are debating Medicare for All and when they're discussing it, um, numbers get thrown around a lot. And these numbers are frequently either inaccurate or they're used incorrectly or their context is not made clear in the discussion. And they can be used in ways that I think kind of turn the debate away from what's actually important. And there's actually probably some questions that we need to be debating and things we need to be talking about that we're not talking about. One question in particular that's very important. If you will indulge me and yourselves, let's take a look at some numbers. So let's start by looking at the figures that I think are at the core of this debate and that get overlooked or forgotten about when we're debating the cost of our healthcare system. And this is the per capita healthcare spending in OECD nations. I pulled this data last week. This is the most recent data that we have. 2018 is the most recent year for which we have data about the total healthcare spending in OECD nations. And you will notice right away that the United States pays an obscene amount compared to other OECD nations. And this includes nations that have universal health care, right? Almost all of these, I think every one of these has universal health care in one way or another. This includes nations like the United Kingdom, which have a government-run, government-provided healthcare system, their NHS. This includes nations like South Korea and Canada, which I colored in lighter blue, because they have systems where there's a single health insurer, but where the delivery of healthcare is still a mix of private and public hospitals and doctors who work for public institutions as well as are in private practice. So Canada and South Korea both have systems that are very similar to what Medicare for All would be. A lot of these other nations have a universal healthcare system that everybody gets, and then a private insurance system on top of that, or in addition to that. So no matter what the model is, we see that the other nations in the OECD pay way less than we do for healthcare, way less per capita. And it's not like we're paying all this money for a top tier system. When you compare the United States to other OECD nations, when it comes to things like health status, quality of care, and health resources, the United States consistently ranks in the middle or below average or even at the bottom. For example, we rank 28th in life expectancy. We are well below average when it comes to hospital beds per capita and doctors per capita. This chart was prepared and published by the OECD, and they leave off a couple stats that are really important to me. One of these is the infant mortality rate. The United States ranks 33rd, or fourth from the bottom, in infant mortality rate. And we rank 35th, so we're second only to Mexico when it comes to the rate of people dying, giving birth, or due to complications from pregnancy. And it should be noted that these numbers were a lot worse before the Affordable Care Act. So the Affordable Care Act is not the cause of these problems. So we are not paying all this money for a top tier system by any measure. And as important as it is to have a conversation about how we will pay for a system like Medicare for All, that conversation means nothing to me if we do not address this more fundamental issue. So the more important question is, why are we paying so much more than other nations for healthcare? Why are we paying double the average for healthcare in the United States of America? I think I know the answer, and that's maybe a topic for another video just because I want to keep this one short. One argument that I outright reject is this idea that a publicly funded health insurance system needs to be more expensive than our current system, right? That like anything quote unquote socialist or whatever has to be more expensive and wasteful. If you're telling me that Medicare for All needs to be more expensive than our current healthcare system, and I can look to Canada, which is paying less than half of what we pay under a system that's very similar to Medicare for All, I'm going to probably come to the conclusion that Medicare for All is not the problem. The problem exists within our current system. And the question is, why and what can we do about it? So now let's take a look at the numbers that people are throwing around in debates. And I'll warn you in advance, this is going to be a little bit of a long conversation, but we're going to go pretty deep into it. So if you want to know more and if you want to be more informed, I encourage you to just keep watching. And most commonly, people are talking about 10-year projections. This is something that is sometimes glossed over or not mentioned. So in the top section, the red section, I have put the projected total healthcare spending under the current system. And two different studies looked at this, and they both came back with figures over $52 trillion over 10 years. Now, it should be pointed out that these two studies are looking at two different 10-year periods. The Mercatus Center study, which is going to come up a lot, is looking at future 10 years, whereas the federal government's national health expenditure projections, that's covering last year, which is the year that we have the most recent data for, and then they are projecting out to 2027. Either way, we're looking at $52 trillion or more over 10 years under the current system, and nobody is arguing this or debating this. So the second section in the middle in blue, these are the numbers that are being most thrown around, and they're also being the most misrepresented and misunderstood. You've probably heard someone say that Medicare for All will be a $32 trillion program, and that's not necessarily true. This $32 trillion figure comes from two different studies. The Urban Institute's study from 2016, which came out during the election cycle, and the Mercatus Center's study from last summer. And they both came back with a figure of around $32 trillion that the federal government would be taking on as a result of Medicare for All. This is not the total cost of the Medicare for All program. Okay, this is the additional costs that the federal government will be taking on in addition to the Medicare program that already exists and the VA healthcare system that already exists and the healthcare plans that the federal government pays to federal employees, which are all going to be included as part of the Medicare for All program. So this $32 trillion number is actually less than the Medicare for All program will be. And Charles Blahous, or however you say his name, is particularly adamant against people misrepresenting the figures in his research. So it's very important to understand what this $32 trillion figure means and where it's coming from. The figures that people should be focusing on are these ones in purple, the projected total healthcare spending under Medicare for All. Right? How much money will we be spending as a nation on healthcare under the Medicare for All system? And how does this compare to what we would be spending if the system stays exactly how it is? So these numbers include the Medicare for All program. They also include any cost sharing, like copays. It includes projected out-of-pocket expenses, and it includes any overhead. So you'll notice that these numbers vary pretty widely, and this brings us to maybe the last important bit, which is that anytime you're making a projection and you're trying to arrive at a figure, you are taking many variables into account. And ultimately, you are choosing which variables to use as part of your projection. For example, will the federal government under Medicare for All be able to negotiate low drug prices from the pharmaceutical industry? Because if you think that we will be able to, your projection will be much lower than a projection that is based on the assumption that we will not be able to negotiate low drug prices. Will the federal government be able to set prices for certain procedures like they do in Japan? This is another variable that has a lot of effect on the overall healthcare spending. So let's briefly talk about these studies. The Urban Institute study and the Mercatus Center study both came back with single projections over 10 years. And in both cases, the number they came up with is less than the overall healthcare spending that is being projected if we don't have a Medicare for All system. And then this report from the Hopbrook Institute provides several different projections based on different variables, based on how much power the federal government will have to control costs. I will link to all of these studies in the comments or the descriptions so you can read them and come to your own conclusions. But I think the biggest takeaway from all of this should be that Medicare for All is going to be less expensive than keeping the system how it is. And the extent to which it will be less expensive than our current system depends on what the program will actually look like and how much power we will have to use various tools to keep costs down. And this brings us back to what I think is the most important question here, right? Which is, why are we currently paying so much for healthcare? And what can be done about it? Now, I'm the type of person that is a lot more attracted to a problem solving mindset and a problem solving type of discussion rather than an ideological one. And we can see how it works in other countries. So this should not be a difficult problem to solve, right? And I think there's a very, very big reason why it continues to be a very big problem to solve. And that's something we can talk about in another video because I want this one to be more about the numbers. So thank you for watching. Share it if you want, and maybe we can get a nice good faith dialogue going about this in the comments.